Hello guys, it's Wileen Pierre, the Director of Foundations of Health Medical Academy. Welcome back. So today we're going to be learning how to do the skill range of motions. Range of motions is very important. So range of motion, the goal is to keep the person moving as much as possible while they're at this level of function. And what that means is you want to keep their body as elastic as possible, because if you don't use it, you lose it. So if they don't move those muscles and exercise those joints, everything tightens up. Their arm becomes tight and you can't move it, which is called a contracture. And then also it keeps them more comfortable, more loose when you're turning and repositioning them. So the first thing we're going to learn today is which joints are they going to test on when you go take your state exam for your CNA license. For the upper body, they're going to test you on the wrist, the elbow, and the shoulder. And for your lower body, they're going to test you on your hips, your knees, and your ankles. So those are the joints that they're going to test you on. So wrist, elbow, shoulders, hip, knees, and ankles are the 6 joints that they're going to test you on for the state exam. Let's begin. I'm going to start by entering the room. May I come in? Hi, my name is Wileen. I'm your CNA for today, and I've come to do your range of motion. Is that okay? Yes? May I check your band? Okay. I'm going to pull your curtain for privacy. I'm going to wash my hands, get my supplies, and I'll be back. I'm going to proceed to wash my hands. There are no supplies for this skill. You are the supplies. And we're going to start with the upper body. So the first joint we're going to do is the wrist. Anytime you're doing a joint, you're going to hold it in the front of the joint and behind the joint. Okay, and the first exercise I'm going to do, I'm going to go 3 times. 1, 2, 3. After about 3 times, you want to check for pain. Do you have pain, Mrs. Smith? No pain? Continue. If they have pain, you put the arm down. You let the nurse know that there is pain in that extremity. You do not continue. You give them their call light, put their bed down, open their curtain, wash your hands, and your skill is done. But if they don't have pain, you're going to continue. So again, I'm going to hold for the joint of the wrist, I'm going to hold the hand in behind the wrist. 1, 2, 3. Mrs. Smith, do you have pain? No pain? Okay. 4, 5. I'm going to roll to the right. 1, 2, 3. Mrs. Smith, do you have pain? No pain? Okay. 4, 5. I'm going to go to the left. 1, 2, 3. Mrs. Smith, do you have pain? No? Okay. 4, 5. Range of motion for the wrist is complete. So we're going to move to the elbow. I'm going to hold in front of the elbow and behind the elbow. And I'm going to do 1 motion. I'm going to bend it up. 1, 2, 3. Do you have pain, Mrs. Smith? No. 4, 5. If your patient cannot talk, look at their face. This is why indirect care is very important. Not only do you talk to them, but you're going to look at her face. And if they have grimacing, when you do something, that is a sign of pain. You want to stop and report that to the nurse. Okay, so range of motion for the elbow is complete. Now we're going to move to the shoulder. If your skill says do range of motion to the shoulder, you're going to hold the wrist, hold the arm, and you're going to go straight up and down. Okay, Mrs. Smith, I'm going to start. 1, 2, 3. Do you have pain, Mrs. Smith? No. I continue to watch Mrs. Smith. 4, 5. Okay, we're going to go out. 1, 2, 3. Do you have pain, Mrs. Smith? No pain? Okay. 4, 5. Okay, Mrs. Smith, we're all done. So that is the range of motion for the upper parts of the body. So for the wrist, you're going to go 1, 2, 3 motion. Pain? No. 4, 5. 1, 2, 3. Pain? No. 4, 5. Left, 1, 2, 3. Do they have pain? No. Continue, 4, 5. For the elbow, you do one motion. You cannot twist the elbow left or right. You do one motion, 1, 2, 3. Is there any pain? No. 4, 5. For the shoulder, you hold the arm here and you hold the arm here for support. You always hold the hand like this, never like this. Always your palm should be up. You hold one hand here and one hand here, and then you would go straight up and down. 1, 2, 3. Any pain here? No. 4, 5. And that is it for the upper part of the body. And for the feet, you're going to do the same. You're going to do the hip, the knees, and the leg. Let's begin. And I've covered her back up because I'm not using this part of her body for dignity. I'm only going to expose her legs. Okay, so for the hip, you do the hip the same way that you did the shoulder. Straight up and down and out. You're going to support the thigh and the calf. And you're going to go like so. 1, 2, 3. Mrs. Smith, do you have pain? No. And I'm also going to be looking for signs of pain. 4, 5. No grimacing. She's okay. We're going to go out. Okay, Mrs. Smith, we're going to go out. 1, 2, 3. Any pain? No. I'm looking for signs of pain. No grimacing. Continue. 4, 5. And the hip joint is completed. Now we're going to go down to the knee, and the knee is the same as the elbow. One motion. And you're going to support the knee and the leg, and you're going to go up, bend back. 1, 2, watching your patient. 3. Mrs. Smith, do you have pain? No? Okay, continue. 4, 5. And that is it for the knee. Now we're going to do the ankle. And you're going to support the foot and support the leg. The ankle joint has to be able to move. So I'm going to go back. 1, 2, 3. Watching my patient and asking, do you have pain, Mrs. Smith? No. No signs of pain. 4, 5. I'm going to go to the right. 1, 2, 3. Mrs. Smith, do you have pain? While looking at my patient, she says no. Continue. 4, 5. I'm going to go the other way. 1, 2, 3. Mrs. Smith, do you have pain? No. Okay. While looking at the patient, she says no. Continue. 4, 5. My range of motion is complete. I'm going to put the leg back down and cover the patient. So this concludes the exercises for range of motion. They will either ask you to do one joint or multiple joints. So it's important that you know your body parts, that you know the wrist, the elbow, and the ankle, also hips, knees, and wrist, elbow, and shoulder, and also hip, knees, and ankles. And that concludes our training. Remember, it's important for range of motion to keep that person to have good movement, decrease pain, and also increase their mobility. All right, have a good day.